This daily multivitamin is used to address vitamin deficiencies caused by a lack of nutrients in the diet, certain health conditions, or during pregnancy. Vitamins are essential for the body and play a key role in maintaining good health. It is recommended to take this multivitamin daily, and the best time to take it is with a meal to help with absorption. When taking daily multivitamin, it is typically recommended to take it by mouth once a day or as directed by your healthcare provider. It's important to follow the directions on the product packaging or as instructed by your doctor, and to not exceed the recommended dosage. Taking this medication regularly will help you get the most benefit from it, so try to take it at the same time each day to help you remember. If you have any questions, be sure to consult your doctor or pharmacist. Some common side effects of taking a daily multivitamin include constipation, diarrhea, or an upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication, it's because they believe that the benefits of taking it outweigh the potential risks of side effects. Many people who use this medication do not experience any serious side effects. While rare, it's important to seek medical help immediately if you experience symptoms of a serious allergic reaction to the multivitamin, such as a rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. If your multivitamin contains iron, be sure to keep it out of reach of children. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years old. If overdose does occur, seek medical help immediately or call a poison control center. Remember, safety first when it comes to storing your multivitamin. Before starting a daily multivitamin, it's important to talk to your doctor or pharmacist if you have any allergies to the ingredients or if you have a history of alcohol use, liver problems, or stomach/intestinal issues. If your multivitamin contains folic acid, be sure to inform your healthcare provider if you have a vitamin B12 deficiency before taking it. It's also important to let your doctor know about all the medications and herbal products you are using before having surgery, and if you are pregnant or breastfeeding, consult your doctor before using a daily multivitamin. When taking a daily multivitamin, it's important to be aware of potential drug interactions. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's best to consult your doctor or pharmacist to find a dosing schedule that works with all your medications. Additionally, if your multivitamin contains folic acid, make sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to note that this medication may interfere with certain lab tests, so it's crucial to inform lab personnel and all your doctors that you're taking a daily multivitamin. If someone takes too much daily multivitamin and experiences severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center. In the US, residents can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to regularly visit your doctor and attend any scheduled lab appointments. Some multivitamin brands may include additional ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to consult with your doctor or pharmacist. It's important to note that taking a daily multivitamin does not replace the need for a healthy and balanced diet. It's always best to get your vitamins and nutrients from whole foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. As for the daily dosage, it's best to follow the instructions on your specific multivitamin label. Typically, it's recommended to take 1 multivitamin per day, but be sure to check the label for any specific instructions. The optimal timing for taking your daily multivitamin can vary depending on the individual and their routine. Some people prefer taking it in the morning with breakfast, while others may find it easier to remember at night before bed. Find a time that works best for you and stick to it consistently. If you forget to take your multivitamin at the usual time, take it as soon as you remember. If it's close to the time of your next dose, just wait and take your next dose as scheduled. Don't take double the amount to make up for the missed dose. When it comes to storing your daily multivitamin, it's important to keep it at room temperature and away from light and moisture. Make sure to avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to getting rid of your multivitamin, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.